What do you mean by neurotechnology? To simply put, it's the technology that works with neuron, also known as nerve cell. It's a cell in the brain and nervous system that sends and receives signals. The field of neurotechnology focuses on creating tools and methods for understanding, observing, and modifying the neurological system. To put it simply, neurotechnology is creating a bridge between the human brain and technology, which creates new avenues for research and advancement in our quality of life. Although neurotechnology has been present for almost 50 years, it has just become fully developed in the last 20 years. The field underwent a revolution when brain imaging became available, enabling researchers to watch the brain's activity in real time while conducting tests. On the next video, my teammate Goran will talk detail about the history of neurotechnology. Thank you.
Today we will explore advancement in the field from 19th century to present day innovation and discuss the promising future of neurotechnology. 19th century milestone. We began in 1849 with Hermann von Helmholtz, who made a groundbreaking discovery by measuring the speed of nerve impulse. This was a significant achievement, laying the foundation for understanding of how the nervous system communicates. Moving into 20th century, we see several critical breakthroughs. In 1924, Hans Berger invented the EEG, which allowed for the recording of the brain activity for the first time. This was a major step forward in brain research. Between 1957 and 1961, the development and improvement of the first cochlear implant took place, providing hearing capabilities to those who were profoundly deaf. In 1985, transcranial magnetic stimulation or TMS was introduced as a new method for brain stimulation. By 1987, deep brain stimulation or DBS was being used to treat Parkinson disease, revolution the way we manage neurological disorders. The 21st century has brought a wave of innovation in neurotechnology. In 2008, TMAS was approved for treating depression. By 2013, Elon Musk's company Neuralink began to advancing brain-machine interface, aiming to bridge the gap between the human brain and external devices. In 2016, wireless brain-computer interface became a reality, enabling a paralyzed individual to control device slowly with their thoughts. 2020 have been significant progress in neuroprosthetics, with the companies like BlackRock, Neurotech, and Synchron leading the way. In 2022, Synchron conducted the first human trial of wireless brain-computer interfaces, implanting its Android device to allow patients to control device wirelessly. In 2023, Kernel developed a non-invasive brain imaging device resembling a helmet to make the brain monitor more accessible and practical. As we look to the future, the neurotechnology timeline showcased the rapid evolution from early discovery in brain stimulation to advanced brain-computer interface and neuroprosthetics. The advancements have significantly enhanced our ability to interact with and understanding the brain. The future holds the promise of even greater innovation, pushing the boundaries of what is possible in fascinating field. Thank you for taking the time to explore the history of our neurotechnology with us. The journey from 19th century to today demonstrates the incredible potential of this field, and we look forward to the exciting development yet to come.
Thank you, Gauran. Now I am going to talk about the types of neurotechnology. There are many types of neurotechnology, but most important ones are deep brain stimulation, transcranial ultrasound stimulation, transcranial magnetic stimulation, electrophysiology, neurotechnological implants, and neuropharmaceuticals. Let's begin with deep brain stimulation. This involves implanting electrodes in specific brain areas to send electrical impulses that regulate abnormal brain activity, commonly used in treating movement disorders like Parkinson's disease. And another types of neurotechnology is transcranial ultrasound stimulation. It uses focused ultrasound waves to modulate brain activity non-invasively, showing therapeutic potential for neurological conditions such as epilepsy and depression. Next one is transcranial magnetic stimulation. This utilizes magnetic fields to stimulate nerve cells in the brain. It has potential in treating conditions like depression, PTSD, epilepsy, migraines, and enhancing cognitive functions. It can be combined with EEG for deeper insights into brain activity. Similarly, we have electrophysiology. It measures electrical activity in the brain by electrodes on the scalp, useful in diagnosing epilepsy, monitoring brain function, and studying sleep. It also detects magnetic fields produced by brain activity, offering more precise localization, and is used in understanding brain functions during tasks. The most popular types of neurotechnology right now is neurotechnological implants. The devices like deep brain stimulators are implanted to regulate brain activity in neurological disorders. Brain computer interfaces and neuroprosthetics are also emerging, enabling control of external devices using brain signals, offering potential and restoring lost functions. Lastly, we have neuropharmaceuticals. It consists of stimulants and sedatives, which are crucial in treating mental health disorders by altering brain chemistry. There are research ongoing into targeted drug delivery using magnetic particles for precise, non-invasive treatment of neurological conditions.